friends, welcome to Origyn Fertility and IVF. I am Dr. Rashmi Sharma. So today I am going to tell you about Asherman syndrome. It's a big name, but simply it means intrauterine adhesions, meaning adhesions inside the uterine cavity. So before understanding that, you have to understand your uterus. So uterus, as we know, inside there is a space, and that space is known as uterine cavity. It is here where your baby is going to grow inside your uterus, and this space is lined by a layer which is called endometrium, and after the endometrium there is myometrium, which is muscle layer, and then there is a peritoneal layer which is serosa. So in some of the women, if this space is obliterated, or if there are adhesions between this space, what we call as intrauterine adhesions or Asherman syndrome. Depending upon how severe the adhesions are, it can be mild, moderate or severe. Mild meaning there are just some bands connecting these walls. Moderate meaning there is some part of the cavity is totally obliterated. And severe where there is no space at all and the endometrium of both the layers has completely stuck together and there is no space left at all. Why it can happen? What are the causes? Most common causes DNC or any kind of trauma to your endometrium, and that DNC usually happens following a miscarriage or following delivery when the placenta was retained inside. So because of that DNC, the endometrium may get curated so much that it gets damaged and then it gets stuck to each other. Sometimes there are infections, notorious infections, especially tuberculosis in our country, tuberculosis and chlamydia. They can also damage the inside wall of the uterus and can lead to scar formations in the uterus. These are the causes. How do you know, or what are the symptoms? The symptoms can be because the endometrium is damaged, and it is the endometrium which leads to menstrual bleeding. So there will be a decrease in the flow of the menstrual blood. So if you are dealing with scanty periods, especially following DNC, then one thing that we have to keep in mind is Asherman syndrome. And if the damage to the uterine cavity is too much, if the whole endometrium is lost, then there can be complete cessation of the periods also, which is amenorrhea. But in some cases, when the scarring is less, only in some places or mild, there may not be any change in your periods, or the change in the periods may be due to some other causes also. How do we diagnose? A good ultrasound doctor sometimes sends us the report, and on the simple ultrasound they can tell us there is some band or some adhesion inside the uterus. And in the same ultrasound, if you put in saline or if you put in water from below and try to inflate the uterus, we can see those bands, and this test is known as saline sonohysterography. That is through ultrasound. The second way of diagnosing it, or how we come to know about it, is by HSG. HSG is an X-ray, which is hysterosalpingography, and this HSG test is so many times done for checking the tubes. So whenever a patient comes to us with an HSG X-ray showing her tubes, we can see inside the uterus also that at some places of the uterus the dye has not gone. Why the dye has not gone? Because there was no space. So in the uterine cavity, in the X-ray, we can see some filling defects, sometimes a honeycomb appearance. So a good HSG X-ray also can make us suspicious that yes, this woman might have some problem with her uterine cavity. The best way or the gold standard to diagnose it is through hysteroscopy, which is actually seeing the adhesions. What is hysteroscopy? Hystero meaning uterus, scopy meaning to see. So we put in a telescope, a small telescope inside your uterus, and from our own eyes through the video camera we can see the whole inside of the uterus, and there we can see the adhesions. The best part is that through hysteroscopy it can even be treated. That is the beauty of minimal surgeries these days. We have videography, we have small instruments. So we going through the same telescope, and with the help of the scissors, those adhesions can be cut, and that is known as hysteroscopic adhesiolysis, and that is actually the treatment for this syndrome. Depending upon how severe your adhesions were, your prognosis will depend. if the adhesions were very severe, if your whole cavity was obliterated, so I would say usually prognosis is very poor, because with the help of hysteroscopy we can cut those adhesions, but they may come back. This is number one. Secondly, the endometrium may fail to grow. The endometrium which has damaged, even if you have separated it, it may fail to grow. So prognosis in severe cases is poor, and usually in severe cases only surrogacy or maybe in future uterus transplant is the option. But if it is mild, then yes, there is hope, and to prevent scar formation further or second time, your doctor may do some tricks like putting in a small balloon after the surgery so that they don't stuck together for some time, giving you some high doses of hormones like estrogen hormones so that your endometrium, we help the endometrium to grow. These are some tricks which your doctor might take. So I would say don't lose hope. If you have been diagnosed with Asherman syndrome, see a good doctor, get it corrected, and go ahead with your treatment.